Today I want to confess something. I want to confess that I am a criminal, right? So here you are, a criminal is presenting something to you. And this so was about 20 years ago. I was at a clinic in Shogunas, and the nurse and I, we were both attended to a patient, and we heard a commotion going outside. A lot of cursing, loud speaking, and so we realized something was happening outside. And suddenly, a guy barged into the room, and we recognized him as the husband of one of the patients we were treating with, some time ago. Now, this patient we were treating was a young lady around 19, and we saw her 4 times before for cases, where she was abused by this gentleman, physically abused. So she was actually coming in for some sprained ankle when she was pushed outside her home. She had a little soft tissue injuries, we would call it, where she would come in with like black and blue marks, the typical black eye. And then we had her coming in up till last week with lacerations cut to her face, where a spoon was used to hit this woman and actually opened up some wounds here. So we had her there the week before, and we were trying to tell her, look, this thing is escalating. This, it's getting worse. The gentleman is getting worse. So you have to get your act together where you would have to make a decision what you want to do. And, even though it happened 4 times with us, it had happened before. And she probably, I think she had went to other clinics. And a startling thing is, she was first abused when she was pregnant. And this is a fact we have to realize. About 30% of women are abused when they are first pregnant. So this is a strange thing. Here you are, somebody's pregnant with your child, and instead of nurturing and caring for this individual, you're going to be beating them. And this is something when we have to recognize or look for these persons who are abused. We try to look sometimes in the antenatal clinics. We try to look with the midwives to see if we can pick up this abuse that occurs. So recognizing somebody who's abused may take us also in the antenatal clinics and the maternity setting. So this gentleman, as I'm continuing this story, he came in, he was shouting, he was sweating. He actually, his fist was clenched. He was walking up and down, and then he stared at us, and we got scared. And as mediators, you have to recognize if there is an individual and he has that level of dangerousness, you have to wonder what you can do. So that level of dangerousness is something that you have to recognize. And sometimes you look at this guy, he may have physical changes, sweating, clenched teeth, shaking, muscle tension. He's now shouting, cursing, getting on, and then he's stamping his feet. And he had all these symptoms. So we were there a bit scared, and typical Trinidadian, the guard was out there now, not even caring. Here's your doctor, they're almost getting beat up, your nurse getting beat up, and the guards are just there outside. So we were there now to fend for ourselves. However, mediators have to look that if you have cases where an aggressive person comes to you, you try to avoid that eye contact. You try to not speak at all, let them just vent and curse and get on. You try to keep your hands, your arms open, your palms outstretched like this, and let them do the talking. Keep a safe distance between you and them, and also get prepared to pick up any objects you may have to defend yourself if needs be, because that can happen. There was a doctor in the Varma clinic, Dr. Gary Warner. He was stabbed with a scissors by a patient. So we have to be prepared. Pick up any sort of thing you have, a book, a fan, get ready to defend yourself. And then, last thing, get ready to exit. So we looked at this individual and we said, listen, after he shouted and we didn't really respond, and he said, you are mother effers, you are encouraging my wife to leave the home. You're encouraging my wife to leave, and she has been with me since 16 years old. And the only way she's leaving that home is if she's leaving in a casket. And I'm going home to kill her now. So when he said that now, we got worried. He stormed out the clinic, and by then we asked the guard again, stop the gentleman. The guard said, well, he's outside the government property, and I have no authority to go after him there. So again, we were in a dilemma. What should we do? And we decided, look, we'll call the police, we'll give the address, and we will take my car, and I went in my little Corolla car, and we sped down that road to get to that individual. And Going to that individual now, we were trying to think, we would reach there before him because he had to take 2 taxis to reach there. So we know we would get to him before, we would get to her before. So almost getting an accident. Then reaching to this place now, we saw the house. It was an old house, Again, we looked at the scenario where domestic violence. If you want to profile these persons who have been abused or even for recurrent abused, generally, we look at young persons, 16 to 19, 16 to 29. Young persons are being abused. Also lower socioeconomic class, but just as Nancy said, this is not necessarily so. And we agree to her because we have seen a wide spectrum of other persons being abused. We know there's a pan arranger who beats more than pan. We know there's an ex-mayor in a car park in Gulf City. We have cases, and recently an attorney was in the news. So you have people in society and all walks of society who have been victims and also have been abusers. So therefore, when we looked at this girl, we are trying to say, does she fit in? And she did fit in with the age, the poverty that exists there. Also, what is important is she was abused, she witnessed abuse as a child. And if you have witnessed abuse as a child, when you are getting older, you may now accept this as a normal part of life. So you may take the abuse and stay within it rather than try to exit. Another factor is found is if somebody has a mental illness or physical illness, they are more likely to be abused. So all of these factors are factors that comes into place. And again, I mentioned she was first abused when she was pregnant with her first child. And this is a startling figure to us in any civilized society. This occurs, and is a figure we should know. First pregnancy, 30% of women are abused. Some figures even in other countries may say 30, 40% sometimes. So therefore, this is a period, if we want to recognize abuse, we have to look at the pregnant females and see how we are going to get them. Some years ago, I did a joint venture with the Midwives Association, and we realized we may have to set up cases where when these women come in, we ask them about any possible abuse. Now, if you notice how an abuser comes into play, he may come to that clinic and sit, and she will be very quiet there, and he answers all the questions. So typically, that controlling behavior will be he's overpowering her. She's not even able to have her own opinion again. And if you are actually, I know somebody who has been abused for years, and this girl, before she was abused, she was a lively person, had her own opinions, she used to always jot them out in. In fact, I found she used to talk too much, but always jotting them out in. But when she got into an abusive relationship, she became a shadow of herself. Her whole body language, she saw always dejected, her shoulders were drooped down. When a question was asked, she would look at her husband, and you realize she was scared to even talk in front of him. She was scared to voice an opinion. So we have to look at how this affects women psychologically. And then some women, if they're affected psychologically, they come to the clinic with depression, with anxiety, with other ailments. Or, and when we see them now, we have to recognize, is this person being abused? But at the antenatal clinics, it was suggested that we look at the antenatal cards and we actually print the numbers of, 1-800-SAVE, the domestic violence hotline. We actually form some link where the nurse can go into the bathroom with this individual when she's passing urine, because the gentleman would not be allowed to go in there, and ask her, are you being abused in any way? So it's to really look and recognize the body language that occurs between the abuser and the abused. So we try to recognize this body language. So therefore, we can get to the pregnant woman if it is handled properly in our antenatal clinics by educating the doctors, by educating the nurses, because the midwives already seem to have their radars up for this situation. So therefore, we are looking at the fact that the amount of times women are not reporting these cases. So if it's one, after 35 times a woman is beaten, then she decides to go and report it. So it's really a hidden epidemic. And then 2 out of 5 cases of domestic violence are not reported in Trinidad. So you find it's out there, but we are not able to detect it. We are not able to detect it. We are able to see when the actual physical assaults come in. We now may be able to track. So going back to the story, I saw this woman there, we looked at her, and we actually told her, listen, we need you to come with us. Your husband is coming, and he'll either damage you badly or he will kill you. She refused to come with us. She just didn't want to come. And, so what we did, we grabbed her, we grabbed the 3 children, we took her in my car, and we carried her down the road now. Now, on the way taking her down, what was significant, the neighbor came out, and the neighbor said, the neighbor knew the nurse from the area. Nurse, I'm glad you're taking her away because that girl has been getting licks at home. And not only that, the first child is also getting licks at home. Now, this is something that you have to know about. 45 to 75% of children who live in an abusive home will themselves become victims of abuse. And I use this figure to try and tell the mothers, listen, if you don't want to come out of the home for whatever reasons, think about that child. That child has a great chance of being abused. So this is something we have to use to appeal to the motherhood, say, listen, get out of that home. That child will be abused. If you love your child, you're not going to stay in there. But again, there are many reasons why women stay. And just as Nancy alluded to some, and I will go into a few others after. So therefore, the neighbor now told me something that was very significant. The neighbor said, Doc, I grew up in the village with his husband. And since that boy is small, he's a worthless boy. He's a waste of time. He's getting into trouble, stealing things from the neighbors, getting into, one day he damaged a dog. He got in trouble in school. He doesn't obey any sort of the authorities. He doesn't listen. He's a guy who's like a deviant. Since from small, he has a problem. And when he told me that is significant because there's something called conduct disorders in children. So conduct disorders in children is a child may not obey the law, not obey authority, be, for animals, be cruel to animals. That conduct behavior in a child, when it's diagnosed, a few of those will go on, about 20, 30% will go on to have antisocial personality disorder. And antisocial personality disorder, as you know, is what we call psychopaths. So therefore, if you have a child and you go back into the psychosocial history and you track that child and say, listen, this child at that age was given that trouble. And that child, if you project, could become an individual who could be antisocial personality disorder, then now we will have some way of looking at children with conduct disorders and trying if we can bring them into treatment, if we can somehow let them, if they're in an abusive home, get them out of that abusive home. Let the Children's Health Authority get them out. Because a study was done in the certain schools in the East-West Corridor by Daphne Phillips, where she looked at violent children. And she said, why you all are violent? And that study showed 40 of them were sexually abused. 30%, you had poverty. Then you had, 15%, you have physical abuse. Then you have verbal abuse. So you have children who are violent, but they may be crying out for help. Because in their homes, you don't know what's happening. So a violent child needs to be looked at and treated with love, attention, and show the child there's something else. Because if that child is violent or exposed to violence at home, even domestic violence, that child now will continue that violence outside, which you call the generational cycle of violence. So it is found that if you are in a home and you're exposed to domestic violence, boys will become beaters and girls will learn to accept the beating. So part of recognizing someone who is a beater is trying to see now, to project, let's project, because we're trying to see how could we save Trinidad and Tobago a few years there? How could we kind of decrease this amount? And how we could do it is tracking children. So you have the children who is disturbed. You let the psychological counseling services in school look at these kids, diagnose them, treat them. By helping that, you will now avoid children becoming adults with other problems, being violent, and in a society creating that level of violence. So therefore, that was a significant fact that the gentleman told me. And we see that if we're looking at the profile of a batterer, let's say I want to recognize a batterer. I'm doing counseling and I see 2 people come in for marriage counseling. And with marriage counseling, there are certain basic issues you have. You may have people quarreling over money, how to spend the resources, how to discipline their children. You find infidelity plays a part. You find different goals. The marriages go stale. And then people have different goals. Somebody may change their religion midway through. So there are different reasons why people coming for counseling in marriages and when we need to mediate. But you see, not all of those persons need greater intervention. Most of those persons you can be able to somehow, teach them to read the moods of the other person, teach them when to keep quiet. For instance, we know now 1 in 7 men are abused by women. So women are now, I don't know if it's not really revenge, they are reacting to a violent society. So women now are hitting at men, and men may be coming out more to say we are abused. And when we are given some sort of counseling, I always tell men, there's something called PMS, premenstrual syndrome. When the hormones could make them act up and get on in a erratic matter, you have to understand that. If my wife tells me this remote is red when she's having her periods, it is red. It is red. And after her periods come back, it will turn whatever color. But you have to do, yes, you have to learn that, and we have to teach men that, because they wouldn't understand. So we say, medically, I would know, and my wife is a doctor, so she knows, but medically, we have to teach men, listen, this can save your marriage, understand that. So it's like a dance. It's like a marriage, like a dance. You dance forward, you dance backwards, but you have to know that certain individuals, if you dance with and you dance wrong, it could be a dance of death. And those individuals, so while the majority of people may be persons who may lose it on a particular day. Let's say a guy has a hard day in work. He comes home. He has somebody cuts in front of him, traffic. So he comes now with this sense of his anger. His wife comes in, starts to tell him certain stuff. He may think she's nagging, and he may lash out at her. She will become like a punching bag for all his frustrations. Sometimes those individuals, if you get them in the majority, are patients that you can help with therapy, you can help with anger management, you can help, to learn how to read each other's moods. But the ones that we want to catch are the ones with the personality disorders. When that gentleman told me that this guy, as a child, had these disturbed problems, and then we saw his anger in clinic. Now, I never had any major intervention with the guy, but it crossed my mind. An angry child, a child with conduct disorder, could lead to antisocial personality disorder. And with the antisocial personality disorder, it is really a disorder where, we termed it psychopath, sociopath, where they have disregard for the feelings of other people. They have persistent lying, stealing, conning others. They are smart. They are smart individuals. They trick us. They trick doctors. You have a psychological test that it was created by Dr. Hunt, where you have checklists to see if you fall in that psychopathology listing. They have an impulsive behavior, and then they also lack remorse for the behavior. So therefore, they may kill and don't feel any sort of regret. It's like you kill a person, it's like you kill a fly. But we have to understand, studies show that when you looked at CAT scans, PET scans of these individuals, their frontal lobes are definitely smaller than the normal individual. And the frontal lobes is how we may have an instinctive drive to lash out at someone, but our cortex brings in certain impulses, tell us, hold strain, we learn things. They have their cortex is smaller when you look at those studies, right? And again, those individuals sometimes are very difficult to treat, very difficult to treat. So therefore, you're looking at that class of individuals belonging to the personality disorders. And a personality disorder is a disorder where it is pervasive and it is persistent. So it occurs, and usually it's difficult to get the person to think otherwise, because it's like they're programmed, they are wired to think in this particular manner. So they are wired like this, and so therefore they come in with the expectations, I want something, I'm going to get it. And it's about 1% in the population. And interesting study in Australia, they found among CEOs, about 4 CEOs out of 100 were psychopaths. So again, if you're working anywhere, look at your CEO and let's get a diagnosis, all right? So beside the antisocial personality disorder, there's something called the borderline personality disorder. Now, borderline personality, it's where their whole emotions, they can't handle their emotions. These persons have a fear of abandonment. Sometimes they may think their partner is going to leave them. They have a pattern of unstable relationship. They're impulsive, so they act impulsive, so they may shoplift, they may have drug abuse, they may go spending sprees. So their whole childhood growing up, when they reach a certain age, you find that they cannot fit in. They may not be able to have a job properly. They don't like to stay in line. They like to go on the shoulders. They like to cut into the lines if you're queuing for something. And they have, some of them have depression, some of them have anxiety. There's an increase in suicidality. So therefore, we had cases where the man will tell the woman, if you leave me, I will kill myself. I can't do it without you. And they can do it. They can play this game, and they can very well go and do it. So cases where you may have murder, suicide, you have to look, is this person really a person suffering from borderline personality disorder? They have also difficulty in handling their emotions. So 1 minute they are good, and next minute they just lose it. So it's difficult sometimes for the wives to carry on a conversation, because she's walking on eggshells. Because really speaking, you really can't predict when he's going off on a tangent. Again, there's the narcissistic personality disorder, where these persons are full of themselves. They think that you owe them, the wife will owe them to do everything for them. She has to treat him as a king or a spoiled boy, that he believes that, and he has a very fragile self-esteem. And even these people, they tend to get very jealous, very quickly, and they think other people are jealous of them. So these three disorders you have to look at with a little closer detail. Because I'm saying, the murders that you see may not be the general domestic violence cases you see, but the ones that are fitting into the borderline, the antisocial personality disorder. And this is the challenge, that if we want to drop the incidence of these murders, we have to know, how could we detect these guys? How could we pick them up? So I am in the clinic, a mediator is somewhere else, there's marriage counselors, but there's no way of picking up these guys. So therefore, the Duluth system, in Duluth, in Minnesota, they're the experts on domestic violence. The whole cycle of violence that we saw, the model, the power play that we saw, they are the ones who developed that. So I respect their programs on domestic violence. And we may have to adopt a zero policy for domestic violence, where the first slap would be able to take that person and bring that person into the judicial system. Now, some people may find it draconian, but you see, how else could we track the individuals who have this personality disorder? So the first slap, once the woman makes a written report, we should be able to say, hey, you're coming into this system. And when you're coming into this system, it means that you're coming into this system, but we have to do a psychosocial history. We have to look at your past. We have to see what is the risk of you going and harming that woman again. We have to try and see if we could do a checklist to see if they have any personality disorder. So therefore, coming into this system is one way that we may have to look at in order to catch these individuals who have the personality disorders. Now, when we get somebody into that system, we also have to look at the fact that, how are we going to look at that risk assessment? So there's something, that was developed by a lecturer in Johns Hopkins University, where she actually had a scale of this gentleman, certain behavior patterns that he will go now and kill that person. And we all need to be educated about that. Police officers, all first responders, social workers, people in mediation. You see, this scale is something that you can look. It's something we call she has what you call a danger assessment tool. And she looked at certain figures, 20 things she looked at, and some of them was if you had a history of beating the woman before, using drugs, if you had attempted to strangle her before, so attempting to strangle somebody, again, is a high predictor. If you also have a gun at home, but in this case, Trinidad, cutlass, everybody has a cutlass. So again, we have to look at certain factors in that danger assessment tool to make an idea if we are going to keep that guy and deny him bail for a while. Deny him bail for a while, the lawyers may say it's draconian, because we are trying to look at a predictive behavior, but we see what's happening in society. We let them come into the system, make the assessment. If it's the majority of cases where we don't think it's any sort of level of dangerousness, let them go out, take counseling. The few that we'll be able to keep in may need more intense counseling. So therefore, the dangerous assessments tool was the tool that I'm thinking that we need to have in Trinidad and Tobago, because our country urgently needs to set up what we also call a domestic violence high-risk team. So a domestic violence high-risk team is a team of individuals who would work with the judges and the magistrates, who would work with the lawyers to try and get divorce procedures, who will work with the mediators to say, listen, this is how we're going to handle it, and who will also work with the victim. So this team, it's a team where you can also now give recommendations. You do that with assessment. You do, and you make recommendations either to keep that person in therapy for a long time. And even the Center for Disease Control, they also have something called the lethality risk assessment. So it's a similar thing, but we need to implement that here. We need to have the domestic violence high-risk team implemented as part of our ongoing fight against domestic violence. And also, one of the 20 I mentioned in this factors, besides, as I say, having a weapon, alcohol use, attempting to strangulate, also we had forced sex. One of it was also loss of jobs. So if somebody has a chronic loss of a job, that is another red flag among the other 20 that you would look at. That person may go and attack this woman. So therefore, look at the economic times we are living in. So if people are losing jobs, there will be a greater incidence of domestic violence. Unless we can have the social workers department reach out to these people and offer them some sort of social services. But a lot of guys are proud. They don't just want social services. So they may have to, I'm tied with a job. So they still feel empowered. I'm going out of the house, I'm making the money, but I'm getting some money. So we have to try to look at what's happening in the economic times and see how we can identify these persons with job losses and see how we can get them into a system feeling again empowered. So the assessment is there, and I'm saying we need that preventative sort of detention, which I'm sure some attorneys may not like, because they're saying you're holding somebody against their rights with a possible action. But I'm saying this can save lives once the risk assessment team uses the model and look at the 20 red flags to see if they're high up on that list. And you find, because the list is given in such, a scale it's given. And that list was developed by a lady called Jacqueline Campbell in Johns Hopkins University, where she teaches in the nursing department there. She's a leader in that, in Johns Hopkins for domestic, and her ideas are ideas that we could implement here. So therefore, you also need now, when you get these people to come in, we need to put these people who have the personality disorders in what we call the batterer's intervention group. And a batterer's intervention group, again, will look at that guy, offer him therapy, look at the whole scenario, and sometimes we'll have to look at these gentlemen and carry them for years in therapy, because some of them would be very resistant to change. We also have to look that if they are ready to break up, that we are willing to to look and have the whole alert system available, that, if you're going to break up, they would know if this individual is dangerous. Use a GPS tracking on them. Go with the times. Let the police make controls at home. Community police should be visiting the lady's home. You should bring back the community patrol system they had. So you have different levels of protection that could be visiting the home of a woman whose husband has a restraining order. Because we found some of them, about 40% of people with restraining orders breach it, and they go back in their homes and it causes problems. And so we need a zero tolerance again for anyone who breaches a restraining order. Zero tolerance, you're coming back into the system, we're going to jail you. You have to go with that part of the sentence means you're going to have to go under some intensive psychotherapy. So therefore, when this gentleman told me about the child that this guy grew up to be, the adult, that this child was conduct disorder, came to adult, my mind went, he has a great potential for killing this woman. So therefore, I told this woman, we are going to carry you to a shelter. She said, no, I don't want to go. I said, but the shelter will try to empower you. They will give you a safe place, because places of safety and the probation orders, it helps. It really helps certain people. But there are still breaches, and we still see people being killed. So she refused to go. So we ended up dropping her by her aunt. And when we dropped her by her aunt, it was, in a sense, a relief, because I told the aunt, listen, this is the social worker's number. I need you to call the social worker. If she changes her mind, keep them safe. So that week, I felt so good with myself that I helped this woman. I went off to the box, I jumped in my car, went with the nurse, we carried her from that situation. We actually carried her to a place of safety. So those are things you feel good. So I give myself a little tap on the back. But that lasted only 1 week. Because 1 week after, police came in the clinic. Dr. Deyalsingh, I'm investigating that you are a kidnapper. So if I had a weak heart, I don't know what would happen. I said, kidnapper? He said, yes. This same lady and her husband, now she had moved back with the husband in a week's time, left her aunt's home, and she's now willing to give evidence that I forcefully took her from her place of home and carried her to another place. And the police officer said, yes, saying you kidnapped her. So I was, you're bewildered, you get disgusted, you want to know what's going on. And, the nurse and I felt so hurt about this. A week before, my mood was so up, now it's so down. It's a good thing I didn't turn bipolar. So then, after now, that week passed. I sat down and said, but listen, why would she do us that? We were trying to save her. We told her about the danger to the children. We told her that, we are giving her a place that she can get out. We'll empower her. She was 16 years old. And you see, part of the problem, we have 16-year-old girls that are getting pregnant and they are living with a guy. So that's further sometimes trap them into that. So unless we deal with teenagers and teenage pregnancy, this problem will continue, because again, it is about 1,000 teenagers less than 19, by the time they are 19, would have had 4 pregnancies. 4 pregnancies. Now, that's a startling figure. So remember, you are trapped in this pregnancy with this guy, and you continue. Not all of them may keep the pregnancy, because some of them may decide they're going to have a backstreet abortion. So therefore, we have to tackle the instance of teenage pregnancies to prevent young persons in that age being trapped in that home. We have to look at children and recognize those with abusive homes to get them out, and to those children to get them also a treatment and get them out of abusive home to stop that intergenerational cycle of violence. So now looking at this gentleman, we already said zero tolerance, we'll get him into the system. So one slap, we might be able to get this guy into the system where we could be able to monitor him and do psychotherapy and see if he's going to be an individual who could kill that woman. We need to know the killers, the risk. We need to get these people and prevent that. So therefore, when we looked at this lady now, we realized now, why did she do us that? But I want to take you back 42 years ago in Sweden, a place called Stockholm. And some of you may have heard about the Stockholm the Stockholm syndrome or phenomenon. In this case, there was a bank robbery, and 6 days the robbers held some people hostage in the bank. But after this was resolved, we found that when the time came for these people to give evidence against the robbers, not one of them wanted to do so. Not one of them. And it baffled the psychological world. Why, people holding you hostage, and you're not willing to go. But they found that if somebody has a gun over your head, that threat of that life and that moment, you owe that person, you figure you owe that person, and you feel that gratitude to that person. And this is why the Stockholm Syndrome came about, and we recognize it. And then we saw it in a case with Patty Hearst, where there was this girl who was kidnapped, and she did bank robberies with her kidnappers also. Then recently there was a case in Russia where a child at 10 years old was kept in captivity, molested by this gentleman. And when he died, she cried and put flowers in his grave. So all these could be explained by the Stockholm Syndrome. And a woman trapped into that relationship, it is in a similar situation where she feels that, that debt of gratitude. So we looked at the Stockholm Syndrome as an explanation why she would have gone back, why she would have been willing to give evidence. But besides the Stockholm Syndrome, there are other psychological factors why people stay. Now, there's what you call the cycle of violence. Now, in the cycle of violence, we have the phases, different phases. And this is something that people who have been treating the victims of domestic violence, it is well recognized. You have the tension building phase where, the breakdown in communication, you're giving her a hard look, you're strupsing, you're cussing on her breath when she comes in the room, you may slap down the phone, so certain tension is building up in the home, and she's feeling this tension building up. And then the beating incident occurs at number 2, where you lash out, you hit her, you beat her up, and those are the cases that some will come to hospital, some may not come, and that is the after the tension phase, the build-up phase, you have the explosive phase, which you call the incident phase, and then the reconciliation phase is where they make up. So the guy goes back to her, and the borderline personality disorder will say, love, I really love you, I didn't mean to hit you, just a little slap, make back with me now. Come now, okay, I'll buy a present for you. And it come like he's courting that woman again. And some women are so in need of love that they will go back and get trapped back. They get trapped into this, what you call the honeymoon phase. And the social worker reminded me there was a case where a woman, she left her home and the husband came and said, let's go for KFC. She went. So woman in Trinidad and Tobago, and she was killed further that day. Women in Trinidad and Tobago are dying for a box of KFC. They are dying for a box of KFC. They might be dying to eat it, but they also dying also. And you see, so the problem is that honeymoon phase, when they come and they offer you things, you make back. You go back with them. You go back with them, and the calm period comes in, but then it starts over again. So this cycle occurs over and over and over again. So then this is another reason why they stay. Another case is something called the battered woman syndrome. So some of you may hear the battered woman syndrome, whereby this woman feels that this man is omnipotent. He's all-powerful. So anywhere I go, he will find me. If I go in a safe house, he's going to get me there. I can't get out of this. He will find me anywhere. So she has this belief, and she refuses to leave because of this all-powerful concept of the guy. And the battered woman syndrome, as the attorneys would know, they use it as a defense now that if, if you murder your husband, they bring it to a lesser charge as this is a defense. I'm not telling you to learn it and go and murder your husband, but the idea is it is a defense. So sometimes, but you think he's all powerful. Now, again, there's something called the traumatic bonding theory, where a battered woman in her childhood witnesses the violence at home and thinks it's normal. So she thinks it's normal, and she actually now equates licks with love. So she figured love, she grows up in that home with her parents beating one another, probably beating her. And when she gets married, well, probably that is it. Love and licks are the same. So if the husband doesn't beat her, she wouldn't feel nice. And this is where this traumatic bonding theory. Then there's the psychological entrapment theory, where a girl will say, well, look, I spent so much money for my wedding dress. I invest all these things already in it. I am already invested in all that relationship. So the psychological entrapment theory is one where you stay into that also. So it's not just the Stockholm sort of incident, it's not just the cycle of violence, there are actually psychological areas that play on the minds of these women. And then multifactorial causes. My religion may say, I don't want to get divorced. I may look at my sisters, and I'll be proud because they are staying in their marriages, or my parents are in their marriage for so many years, I want to show them I can stay. And you are staying in an abusive relationship, regardless of all these factors. So again, you have to look at a woman who is not willing to leave. And what I'm saying, sometimes we have to save these women from themselves. Sometimes we, as therapists, may have to say, if you can't leave, if it's like, the psychological chains that bind a woman to her batterer sometimes are stronger than the physical chains. So we will judge that woman and say, she's silly, she's stupid, she could get out of that. But sometimes it is such a strong bond that she cannot. So it's something we need to look at. So therefore, let's see now, how are we going to recognize these things? We look at a woman being beaten, we could look in the system, we could see the cases that come to us with abuse, physical abuse. But a lot of women are out there suffering in silence because they are emotionally abused in the sense that, look at this famous case. You remember Rihanna, who recognized Rihanna? Rihanna had all the money in the world, all the fame in the world, but Rihanna got abused. And I think she's still with the gentleman. Is she trapped into that relationship? Is she psychologically trapped? Because she has all the resources to move out, to walk back, to move back into Barbados, such a lovely island if she wants. So therefore, we try to see why, these women stay into the relationships. And we also look at the fact that An abuser in Trinidad and an abuser in America, an abuser in different countries, all of them use the same techniques of control. So when you say we are one with humanity, all of them have the same techniques of control. So therefore, you find that they will use intimidation. They may put a gun or a cutlass and say, if you leave me, I'm going to kill you. They may use emotional abuse, where they constantly, using emotion, where they're telling her that, I will beat you, I will kill you. You would use children sometimes and parents. I will kill your children. Some people use the pets. I will kill the pet. So therefore, you use isolation. You stop her from a phone. You stop her from a friend. You stop her from a church. You actually prevent her from having any sort of contact. You use the male privilege, because there are certain gender concepts that male have. It's a patriarchal society. That is why we educate the male sometimes when we are trying to deal with that. You use economic abuse. You stop them from studying. You stop them from pursuing any sort of jobs to keep them home. And you use force and threat. So these women, they are suffering. And some women, they may not ever have physical abuse, but they may have such emotional, psychological abuse that they are suffering, and they are suffering in silence. And those cases may never, ever come to us. It's your duty to look at a friend. It's your duty to see a sister or somebody who's with a partner changing their whole appearance, becoming a person that they were not, and recognize that person may be undergoing psychological abuse. We have to try and see if we can help her to come out of that. And if you see your daughters or your sisters getting into a relationship, the danger signs are simple. Those gentlemen tend to move too quickly. So if I had a daughter, I'd tell her, look, these are the danger signs. You like a person. If it's happening too quickly, let us see this gentleman suddenly comes into your life, and within 6 months, you call it a whirlwind romance. I want to marry you. You're the girl of my dreams. Do not go for that. Do not fall for that. Within 6 months, we don't recommend that. Get to know the guy out. So the whirlwind romance is very, very something you look out for, where they're up in your face. So suddenly they're showing you the gifts. They're showing you the attention. They're going to all places you go to, your gym. So again, so too much in your face, in the sense that they are there every single part of your life in such a way that you feel that, you've known this person a long time, because they're giving you so much information about themselves, which may be false, and they're telling you things, they're telling you how they love you, they want to spend their life about you, and they're very quickly trying to give you that attention, and you are so overwhelmed by that attention. Sometimes they catch you at a low moment when you're sleeping in the night, and you may blurt out some of your private stuff, because that level of intimacy you have is really not a real level. It's really with the constant bombardment that they come at you. So too fast, too quick, and control. Anytime they want to control you, you go in a restaurant, they want to choose where to sit. They want to choose what's in the meal. They want to control who you're speaking to. They want to control who your numbers you have on your phone. Those are signals. Anybody going into a relationship with somebody like that, say, move out. Because that is what you call preventative measures. Preventative measures is danger signs in that. And it happens, as I'm saying, the same pattern of behavior can happen in Trinidad, can happen anywhere in the world. So it's something that control, that power that comes in. So what I'm saying is that in looking at these women, we have to realize that some women are not able to save themselves. Some women are not able to leave. And I think we will have no choice to decide if somehow we are going to change the law to save certain women. Because just like the Mental Health Act would allow someone to pick up somebody who is acting in a strange manner that can harm himself or to harm another person, the Mental Health Act allows for something, you call an apprehension order. You take them away and lock them up, or you remove them from that situation if they are at risk for themselves or another person. Just as how we have that in law. We may need to think if we need to go a step further, change our laws to be able to rescue women who may not be able to rescue themselves. Thank you.